Would you suffer 8 years without trying something different? Please do not do that. If you're suffering with a chronic illness and the mainstream medical model is not helping you, don't wait 8 years to look elsewhere. Today I consulted with a person that's been suffering with an IBS diagnosis since 2010. This person is now suffering from symptoms that make it seem like, or make me question whether the diagnosis has now progressed to something even worse, and if this person was managed properly early on, may have never reached here. What do I think is going on? Let's discuss that today. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. So the consultation today was with a person with an IBS diagnosis. And this IBS diagnosis was given in 2010. And you may know enough about IBS to ask, well, is it with constipation or diarrhea? Well, this person is a mix of both, so constipation and diarrhea. Well, since the initial diagnosis in 2010, this person's IBS has now progressed to anxiety, panic attacks, and insomnia are now included with it. The person's significant other states that it's so bad that the person is crippled by panic attacks and is up all night going to the bathroom. So you could imagine how this person's performance as a spouse, at work, and quality of life could all be terrible and have been for a period of time. Well, the mainstream medical management of this person's case has been to do nothing about the IBS, but to prescribe Zoloft, Xanax for the anxiety, panic attacks, and insomnia. If you are up to speed with health issues, then you may be aware of gut-brain, brain-gut loops, or the gut-brain axis, and you may know that many times people start with a GI complaint, and if it's poorly managed or unmanaged, over years they develop now neurocognitive complaints, so the gut-brain end of the axis. And alternatively, people can start with neurocognitive complaints only and be mismanaged, and over a period of years now develop GI complaints. That's the brain-gut end of the loop. Well, this person is a gut-brain loop. This person received an IBS diagnosis in 2010, was not properly managed, and now has the neurocognitive complaints of anxiety, panic attacks, and insomnia. And now medicine is only addressing that, excuse me, because they have medications for that, but they're not addressing the IBS. Well, another symptom going on is this person has lost 20 pounds in the last couple months without wanting to or trying to. So to me, that sends up a red flag that we may not be dealing with only IBS now, but it may now be IBD, or inflammatory bowel disease. And inflammatory bowel diseases are things such as Crohn's, ulcerative colitis, and celiac disease. When this person was questioned about their last endoscopy or colonoscopy, they haven't had one in years. So they've received an IBS diagnosis, not been properly followed. Their symptoms are being addressed with drugs, but the cause is not being addressed, and now they're losing weight for no reason, which makes me think, hey, is this inflammatory? And a bigger deal than IBS, is it IBD? And now there's an autoimmune and or autoinflammatory disease going on. So this person needs to receive the CSI health detective work that we do to determine what's going on. Is this autoimmune, autoinflammatory, etc., etc.? And you do as well. If you've been suffering for years and years and you keep going back to your doctor and they keep saying, well, let's watch for 3 more months, let's watch for 3 more months, and they're not doing any diagnostics, like in this case, a colonoscopy and or endoscopy is warranted, and they're not looking for other things, then you're just being pushed away until there's something so obvious that is diagnosable and there's a procedure like a surgery or a big time drug to give you. Then they'll do something. Let's not wait till then, because by then your quality of life will be awful. You'll be not sleeping and in the bathroom all night, and when you are awake and trying to perform as a spouse or at work, you may be having panic attacks and anxiety that cripple you. You don't have to live this way. There is hope. You just have to function in a paradigm that understands physiology and you as a complete whole instead of you as some label or diagnosis. That's what functional medicine does on a daily basis worldwide. So if this is you or you are similar to this, seek out a functional medicine practitioner near you that knows what they're doing and can work you up appropriately and get you the care you need.